All right, the name of this lecture is Everything You Ever Wanted to Know About Management and Delegation. If you haven't already printed out these notes, you need to print these notes out first. Now, let me say something. You can't say that I haven't gone to the extremes to keep these lectures fun, all right? I'm in my favorite place in the whole wide world, which is Sandestin, Florida. And when you pass your boards, I want you to take you a trip too. You deserve it, okay? Now, let me tell you something. I'll have people that call me that have failed their boards, that have never taken my review, and tell me, Ms. Hurst, I only need help with management delegation. Don't give me all that med-surg. I just need help with management delegation. Well, let me tell you, until you've mastered the management and delegation, you'll never be able to, until you've mastered the med-surg, you won't be able to get the management delegation. So you've got to understand your content first, your med-surg, your OB, peds, and psych, predominantly your med-surg. Then you can move into management delegation, okay? You'll see what I mean when we start looking at more test questions. So if you haven't printed out this handout, you need to stop right here and print the handout out first so you can go along with me. All right, so on your handout it says, what is delegation? Well, delegation is designating tasks to others, but the RN retains accountability. You see, that's what you and I don't like about delegating. You and I think that when we delegate something to someone, they ought to be accountable for what they do. Well, in the real world, that's not the way it is. You and I, the RN, is always accountable for what you delegate, okay? So that's why all of you need malpractice insurance. And by the way, if you need malpractice insurance, contact me. I know about that too. All right? Now, look at the next statement. You must always evaluate. That's one of your biggest responsibilities as an RN, to evaluate the delegated task, okay? Evaluate the delegated task. Don't just assume because you tell somebody to do something, it's going to be done properly. Well, we want to know things. Was the task done properly? Was the task done in the proper time frame? And is the patient all right? Because in the end, you are responsible for that patient. You see, y'all, and I'm afraid that this is a problem that's only going to get worse over the years, because we don't see a lot of people going into nursing like they used to. Even before, when there was a nursing shortage, people would hear about the nursing shortage and a lot of people would go into nursing. Well, we have a nursing shortage now, and that's still not happening. People aren't going into nursing like they used to. But what we are seeing is the training of more and more and more nursing assistants. So over the years in your career, you may see yourself delegating and managing other people more than ever. So that's why this has become such an important issue. Don't assume someone is competent to do something just because of their job description. Just because somebody's an LPN, don't assume they know how to do all LPN things. Just because someone is a nursing assistant, don't assume they know how to do all nursing assistant things. It depends on a lot of things. Let's look at some examples here. Let's say you've got a nursing assistant with 20 years of experience. See, 20 years of experience. That's to make you think, oh, 20 years of experience, they know everything. No. Has been working in the well baby nursery for the past 5 years. And this person has just gotten pulled to the orthopedic floor. And you have a post-op hip that needs to get up into the chair. Well, nursing assistants have been taught basic transfer and positioning of patients in their programs. I know that. But this nurse, I don't care that she's been a nursing assistant for 20 years. Where has she been working? In the well baby nursery. That's where she's been working. So her skills are really focused in on the well baby nursery, not on the orthopedic floor. If you're going to transfer an orthopedic patient, especially somebody that's a post-op hip, to the chair, aren't there some specific things that need to be done? Yes, in the transfer of that patient. You know, in the transfer of the orthopedic post-op hip patient, that they have to keep their legs apart, abducted. You don't want them to bear weight on the affected side or the surgical side. You don't want them bearing any weight, that sort of thing, okay? So you've got to be careful. So see, there are specific things that nursing assistant needs to know before they ever go and transfer that patient. If you've got, don't assume just because they're a nursing assistant they can go and do that just like that. There are specific instructions, concrete instructions that you must give before you ever let that nursing assistant transfer that patient. If you're unsure, go with the nursing assistant yourself and help them transfer the patient to make sure there wasn't any harm brought to that patient. Now look at the next statement. When someone is pulled to a new floor, pretend they are a new nurse all over again. Do not give this nurse any patients requiring specialized care. Okay, this happens all the time in hospitals. I may go to work in the medical intensive care unit where I've worked for the past 3 years, and when I get there and I take report on my patients, they say, the supervisor comes through and says, Marlene, you're going to have to go to the renal floor tonight. Well, I can't argue. I have to go. If it's my turn to go, I have to go. But when I go to that new renal floor, they are supposed to pretend that I am a brand new nurse. They don't look at, well, she's a critical care nurse. She's been working there. She knows what to do. Give her that side of the hall, and I'll take this side of the hall. That's not the way it's supposed to be done. You pretend they're a brand new nurse. Do not give me anything that requires specialized care. I've been working in medical intensive care. Don't give me somebody who needs peritoneal dialysis. I haven't been doing peritoneal dialysis, and it requires specialized care to do that. So you have to pretend I'm a brand new nurse all over again. That is the key to answering those kind of test questions. Let's look at the next example. We've got an ER nurse with 15 years of experience, and she gets pulled to the labor and delivery unit. Which patient would you give this nurse? Okay? Been working in the ER, pulled to labor and delivery. Brand new nurse once again. So, do you give me the patient with a severe DVT with bilateral involvement? Do you give me the patient in active labor? The patient who is 8 hours postpartum? Or the patient requiring fetal monitoring? Now, I want you to take about 15 seconds and think about that scenario. Well, I hope if I've been working in the